Hey everyone, welcome back to the channel. This is Aryan Malik, and here we are in Study with Me series. Today is day 13. We'll be continuing our discussion on chest tubes. So, I use an analogy to understand it better. So, it goes like this. So, a straight catheter is to a Foley catheter as a thoracentesis to a chest tube. So what do I mean by that is like straight catheter, it's like just in and out. It's a quick process. While a Foley catheter, it's chase in, it's like secure, continuous training. Uh, whilst thoracentesis is similar to how straight cath works, so it's again in and out. While the chest tube is similar to how a Foley catheter function, it just stays in and it's secured. And mind you, this is a summary of Mark Kilmek lecture. So I'm just presenting here a summary of my notes that I took while listening to Mark audio. So the next thing Mark talks about is which one has higher risk of infection, thoracentesis or chest tube. It will be chest tube because it stays in longer and there is much more possibility of having infection through that. Now let's talk about rules for clamping the tubes. So one should never clamp more than 15 seconds without doctor's order, and one should use rubber tipped double clamps to avoid puncturing. So why is it the 15-second rule is so how is it follows is basically whenever there is a break in the water seal. We yesterday talked about the steps, so let's just repeat it one more time. The first thing is we clamp it, which should not be more than 15 seconds, and within those 15 seconds we have to cut off and put it underwater. And if we take more than 15 seconds, we would have to release the tube. Now let's talk about congenital heart defects or CHDs, which are mainly the abnormality in the heart which are developed before birth. So there is again a type of a statement which kind of makes things much easier. So there is a word trouble. So every congenital heart defect is either trouble or no trouble. So either a congenital heart defect causes a lot of problem or it is not a big deal at all and there is no in between defect. So either it will be like too much kind of problem for a patient or it will be just like a not a big deal. So let's break down the word trouble, which will help us kind of make the whole concept of CHDs a little easier. So I want you to write down the word trouble on a paper so it's easier for you. So now I want you to capitalize all the consonants. So T capital, R capital, and let the vowels be small. O small, U small, then B capital, L capital, and E small. So let us say we have a congenital heart defect or trouble defects. What does it say in terms of what do we need to do? We need to do surgery or not? Yes, we need to do a surgery because trouble. The word says trouble, so we need to act on it immediately. And if we have no congenital heart defect or no trouble, do we need a surgery? No, it can be we might need in the future, but immediately there is no need of the surgery, and there are very less chances that in the future also it might be a reason for the surgery. So let's talk more about the differentiation between trouble defects and no trouble defects. So in terms of growth and development, in trouble, the development and growth is slow, while in no trouble, it's normal. And in trouble, they have life expectancy to be hindered. It's not good, while in not trouble, it's normal. the parents in trouble, they face many problems like grief, stress, financial problems, while in no trouble they don't have any such problems. And in trouble, patients usually go home on an apnea monitor, while in no trouble, patients just go home whenever they are done with the procedure. And in trouble, the patient usually stays for a longer time in the hospital, while in no trouble, patients usually go home after I think 24 to 36 hours. And I think that's pretty much it about the differentiation between both of them. And now just let's look at the patient teaching for a child who is on tetralogy of pallor, and let's analyze what we as registered nurse will teach them. So we assess first of all whether it is trouble or no trouble, and our rule is that teaching the parent the implications. If it's trouble, tell them it is going to be a lot of problem for them. And if it is no trouble, we pick the answers that says no trouble. So let's dissect more into it and understand the term trouble. And trouble, so what I want you to do is basically pay attention to R and L, as that will give us an indication of kind of working this out. A congenital heart defect is right to left shunting of the blood. So what is right to left shunting of the blood is basically that oxygen poor blood doesn't always go to our lungs, which in turn leads it mixing with the oxygen rich blood when it is coming out of the lungs. And when that goes into the circulation, it might show up as hypoxia, loss of oxygen, wherein the infants might turn blue. And the no trouble defects are basically left to right. And in that, I think it's there is no problem as such as like patient turning blue. They rather are pink because there is no oxygen imbalance. And if a kid has, so like if in a question they said that the infant has a right to left shunt, what will be the patient teaching? So we understand that right to left shunt is not good, it is trouble. So the patient might need surgery, while left to right shunt is normal for both growth and development, and in terms of no surgery is needed. So let's understand the characteristics of trouble. It shunts the blood from right to left, and the patient is cyanotic. They have delayed growth. They need a pediatric cardiologist, and they also have exercise intolerance, and they need medications. While they also need apnea monitor, and they need to stay longer at a hospital, and they have decreased life expectancy. While in no trouble, it is left to right shunt. The infant is pink, and it's not a big deal. So what are some examples of trouble? So how Mark breaks it is, so anything that starts with T, as in letter T, will be trouble. So say truncus arteriosus, transposition of great vessels, tetralogy of Fallot, tricuspid stenosis. These all will be trouble, and they will be characterized with right to left shunts. The patient will be blue, cyanotic, and it will be not good for the patient. While not trouble are like, for example, ventricular septal defect, pulmonary stenosis, patent ductus arteriosus. So anything that does not starts with the letter T will be no trouble, and our patient teaching will involve that the patient is having left to right shunt, the patient will be pink, acyanotic, and the patient is all good, and they will be having a good life expectancy and a normal growth and development. And all congenital heart defects, irrespective of whether they are trouble or not trouble, will have two things in common. First of all, murmur. Now, why will they be having murmurs? Because they are experiencing the shunting of the blood, whether it is right to left or left to right. So that is why we will be, upon assessment, hear murmurs. And second, they will be having an echocardiogram check, because that is what helps us determine whether the patient or the person has CHD or not. Now let's look at the defects in tetralogy of Fallot, which is a trouble or a dangerous or a serious congenital heart defect. The way Mark recommends remembering this is using a statement which is varied pictures of a ranch. Now, I want you to pay attention to each word's first and last letter. Let's look at one by one. So, varied, VARIED. Look at V and D. That is one of the symptoms or the defects present in tetralogy of Fallot, which is ventricular defect. Then pictures, P and S, pulmonary stenosis. Then of a, so we'll be using it as together. So A, O and A, which is overriding aorta, and ranch, R and H, which is right hypertrophy. So this might show up on the NCLEX in a form of select all that apply, tetralogy of Fallot defects. So we have ventricular defect, pulmonary stenosis, overriding aorta, and right hypertrophy. And just to summarize, what do we have to know to better help us in terms of congenital defects? Just two words: trouble and varied pictures of a ranch. Basically, one word, trouble, and a statement which will help us with the determining the symptoms or the defects of tetralogy of Fallot. That marks the conclusion of congenital heart defects. I hope you found this video helpful. Please stay tuned for more videos that come in the future. Thank you for watching.